I'm Lawrence Gostin. I'm professor of global health law at Georgetown University in Washington, D.C. I'm the director of the O'Neill Institute for National and Global Health Law, and I'm the director of the World Health Organization Center on Global Health. It's excellent. I really am enjoying it. It's very good, and I'm very much looking forward to helping to write the Incheon Declaration. I think the conference is defining it very well. I mean, a healthy city is one where its people can have all of the conditions necessary for health and emotional well-being. And that requires a number of things. Of course, it requires all the social, economic determinants of health. So things like education, jobs and income, empowerment of communities and non-discrimination, all of those things. But it also means that it has to be a city where there's ample potable water, nutritious food, that there's opportunities for safe and mass transportation through metro systems and buses and other mechanisms. But it also requires that people want to live, even though they're in a city and it's very built up, they want it to be green. They want it to be verdant. And so everybody in a city should be able to walk to a park. Everybody should be able to walk to a playground for your children that's safe and beautiful. And there should be nutritious food. So everybody should have ample access to fruits and vegetables and lean protein. And that basically it should be a city that should be sustainable. And so it should be based upon sustainable forms of energy. You know, I often say to my students, and I've done this throughout the world, this kind of, it's a thought experiment. I've done it in Seoul, I've done it in Beijing, Hong Kong, I've done it in Oslo, in Kampala, in Uganda, Buenos Aires, and everybody says the same thing. So basically, this is the kind of life that people want. They want to get up in the morning and they want to go and have clean water to wash their face and brush their teeth. They want to go to their kitchen table and they want to be able to have safe, nutritious, good food. Then they want to leave their home and they want to be able to not be attacked by malaria mosquitoes or other vermin. They want to be able to get in a safe vehicle. They want tobacco control, alcohol control. They want to go to work in a safe, clean workspace. This is just universal yearning. And notice I didn't say anything about medicine or healthcare. Medicine is important and healthcare is important, but it's actually a very, very small part of what makes us healthy and happy. What makes us healthy and happy is living in communities where you can breathe fresh air, where you can have plenty of clean water, good food, parks, playgrounds, mass transportation, all without pollution and fossil fuels. It's really very simple having a smart city, but we don't do it. I don't know why we don't do it. If you go to many of the big cities around the world, if you go to Delhi, if you go to Johannesburg, or many of the other really crowded cities, it'll be hard to breathe. There'll be pollution, there'll be poverty, there won't be good housing, you can't trust the food or the water. That's no way, no human being wants to live that way. We know what to do. It doesn't cost a lot. In fact, it costs less than what we're doing now. We have to make it a political priority.
Your last sentence was a political priority. So you need to put political priority on it.
You do, because these are political choices. Yeah. We can spend on arms and defense. We can, spend on, going to the moon, whatever it might be. We can also spend on very expensive biomedical technologies, and I'm all in favor of that. But if you actually look around the world and you look at what countries spend, a lot of it's on things that I wouldn't prioritize. But even among the health dollars, normally about over 95%, and sometimes even more than 95%, is about medicine. It's about, doctors, hospitals, ambulances. But we don't do upstream prevention. We don't do the public health things. We don't invest in disease prevention and control, injury prevention and control, and just really creating the conditions where people live. We like to think of ourselves as a human species as, we can make our own choices and, we're autonomous. But the truth is that we're only an animal, and animals survive in good environments, in pleasant environments, in hospitable environments. And we've made our environment so inhospitable, so unpleasant, so unhealthy, so dangerous. And we've all suffered the consequences. As a result, not only are we not healthy, we've got obesity, overweight, tobacco, malaria, dengue, cholera, you name it. But we're unhappy. And I would add one more thing. We need neighborhoods where people can have social connection. We need community centers, places where people can gather to talk to one another, to get to know one another, to love one another, instead of all the hate that we see around the world these days. I want to mention one other thing, if I may, because this is my father, who lived to 102. Wow. He had told me a lot of wonderful stories, but one of the things that I remember, and my sons and grandchildren remember, because he told it to me, he always said, the car is the enemy. And if you think about it, I know this is controversial, but if you think about it, virtually all cars are combustion engines. So they're constantly creating explosions, they're polluting the atmosphere. We spend so much money on buying and repairing automobiles, investing in roads, highways. When highways get too crowded, we build more highways and more. And of course, the answer isn't more combustion engines and more roads and highways. The answer is, safe, convenient, carbon neutral transportation. It's so obvious, but again, we don't do it. Everybody wants to drive around in their, 1 or 2 ton SUV, and the cars get bigger, and the roads get bigger, and they get more congested, and we keep investing more money and more money in it. And it means that it's very dangerous to bike, to walk, to do all the things that we need to be, not just to be healthy, but to be happy. Another thing my father said on his 100th birthday, he said, I came a time when I got older that I couldn't run, and that was all right. And there came a time when I couldn't swim, and that was all right. And there even came a time when I couldn't bike, but he biked on about 15 kilometers on his 90th birthday. But he said, if I can't walk, it won't be all right. And one day he had a massive leg infection, and at 102 died because he couldn't walk anymore. I mean, it's just a basic human thing, to be able to, walk around a city. Seoul is not a very easy city to walk around, for example.
No, not exactly. Here comes my last question. World Health City Forum. The forum will continue year on year, and this year the questions I asked you was the sort of the big questions.
Yeah.
To answer, so that we have ideas to create a healthier city. And what you mentioned about the importance of enforcement. Standard and indicators are important, but enforcement it's more important.
Enforcement, but also compliance, because sometimes you don't need to force it if you make an economic incentive to do it, if you show that it's cost effective. And ultimately, the people have to ask for it. We've been brought up and bred as city dwellers as expecting certain things. And our politicians reflect that. I'm glad you're really hosting this forum, because I work in the field of, big ideas like global health security. And I work on that. But really, what's more important probably is not necessarily pandemics, because what's most important is that we live in places where we can, eat well, live well, play safely, and breathe good, clean air. And if you go around the world, that's not what you find.
And for the next year, can you share some insight on what kind of question we should ask to people?
You know what? I think it would be good to start with small but very meaningful, important steps. So, 1 year you could focus on just kind of basic breathing, hygiene, and sanitation. Just those basic things, the air we breathe, the sanitation that we have in our streets, including the mosquitoes and the rubbish and the sewage, and the hygiene. All of those would be good. I would include safe, pure food. And then another year we could do things like non-communicable diseases. There are very clear things we can do to have much better physical activity, nutrition, very, very clear steps. I've worked on these all of my life. They're not popular now because we're all talking about pandemics. I would love to be able to get back to what it takes to make people healthy.